Hi everyone, my name is Kosta Ikonomou, sports physiotherapist at Coatman Healthcare in downtown Vancouver. So today's educational series, we're going to be talking about osteoarthritis. We're going to talk about what is osteoarthritis, some of the definition of osteoarthritis, signs and symptoms, is it reversible, and we're talking about the most up-to-date guidelines on how osteoarthritis is managed. Before we get going, I want to say that this is an educational video and not to be used for clinical diagnosis or to substitute any clinical examination that you may have had for osteoarthritis. But by all means, if you have any questions, I'm more than happy to answer anything that either you would like me to elaborate on from this video or just in general questions. Happy to answer anything that you've had, the questions that you have. All right, so let's get going. So what is osteoarthritis? Osteoarthritis has kind of been defined as this degenerative joint disease, wear and tear kind of arthritis. Or other individuals have said it's a underloading or overloading a biomechanical disease. We'll talk a bit more about that, but osteoarthritis is the most common form of arthritis that we see. So kind of what happens is within our joints we have cartilage. Now kind of the role of the cartilage is to apply a frictionless surface. Cartilage is almost like 4 times more frictionless than ice, so it's very smooth, very slippery, great for mobilizing our joints. Now, over time, what can happen if you underload it, meaning you're not doing enough exercise, or you're doing too much of a certain activity, your muscles around it are not able to dissipate a lot of the forces, and you're kind of exceeding the capacity of the joints, you start to get breakdown of this cartilage. Now and then, through that, you get increase in different bone changes around. Again, your bodies want to adapt to the activity you're doing. So over time, you may get increase in bone osteophytes, which is basically bone changes. Now these over time can be a bit disruptive and may cause pain. So kind of what are the risk factors? We tend to see it again. Osteoarthritis isn't something that just happens overnight. It is something that happens over time. There's definitely individuals who are over the age of 50 tend to experience have been diagnosed with osteoarthritis. So it is an age-related changes that we see as well, more prevalent in women than men. Now there is a genetic component as well. So if you have a family member who has osteoarthritis, you are more likely to also get it. Then more commonly obesity. So if you are overweight, you are more common of getting osteoarthritis. And again, the belief is that we are overloading these joints, and because the joints now are having to deal with more of the force going through them, you get bone adaptation. Now, there also could be the increased stress on the joint, but there's also a metabolic effect. So maybe there's kind of a biological effect as well, which causes these changes. Now, kind of the signs and symptoms. So we're looking at when you have osteoarthritis, most complaints are pain with activity or just with increased rest, stiffness in the morning, or after an activity for like 30 minutes. So very commonly individuals will come to me and say, I feel quite stiff in the morning, but then once I get moving, it's okay. Or if I'm sitting at my desk a while, I get some knee pain, then I get moving, and again, it kind of helps. And that's because your joints love and the cartilage love to be lubricated. So they love movement. So we want to get fluid going through there. Another thing we'll see is impaired function. So individuals will say, I used to be able to do this activity, but now I just can't. Some signs, Crepitus. So Crepitus is kind of like that creaking that you hear. Again, this could just be a sign of there's a little bit of increased fluid, most likely where that creaking is coming from. Some people just have creaky knees, so it's not always a be-all sign of it. Again, this is a picture that we're painting here. Usually is painful or have restricted movement with osteoarthritis, and you tend to see bony enlargement, so there is a sense of bony changes that we talked about that the body kind of adapts over time. We usually diagnose with clinical signs and symptoms plus x-ray. So we like to see on film, is there actual degenerative changes onto our joints. Now keep in mind that there have been studies, so Altman et al. Did a study where 40% of individuals with degenerative changes in their scan had no pain, which is why we always take signs and symptoms plus the scan. We don't just use the scan as our be-all and all. So can you reverse away? So we talked about osteoarthritis being like the cartilage first kind of breaks down and then which leads to the bony changes. So what we found in rat studies, and they've only done this in animal studies, is that you can reverse cartilage. So what they did is they took laboratory rats and they immobilized their leg. So they weren't able to do it. And what they saw is the cartilage started to get degenerative changes because they weren't using it. Now, what they did is they let the rat, again, immobilized it, let them use their leg, and they started to see these reverse changes happen in the cartilage. So this is a really good thing because it can tell us that potentially in humans, if we start exercising, we can prolong the risk of cartilage changes, which can lead to bony changes, so osteoarthritis. Now in the study, what they did find is there was a point of no return. So if the cartilage wore down too much and then there was bony changes coming, you cannot reverse that. But luckily what we can do is, and this is recommended in the guidelines as well, is we can protect the joint. So how can we do that? So let's segue into like what the actual treatment strategies are. So we talked about this kind of in the rat studies, the point of no return. So say you have been diagnosed with osteoarthritis and you're trying to figure out, okay, I know I can't reverse this, but what can I do? You can, first thing that most likely is probably the easiest thing to do is change certain lifestyle factors. So again, that's eating a little bit healthier, sleeping well, decreasing stress, quit smoking if you do, and start exercising. So I know those can be a bit harder than, easier said than done, as you say, but it's slowly chipping away at seeing what you can do immediately, and then working slowly through those. But increasing your physical activity, like I said, the joints love lubrication, they love movement. So we want to get the muscles around them stronger to protect the joints. Losing weight is a huge thing when it comes to osteoarthritis because, for example, especially in our knees, our hips and knees, they're load-bearing joints. So if we tend to lose weight, we can offload these joints. Now, if, for example, like when we go up and down stairs, we put 4 times our body weight through our knees. Now, the knees are the biggest joint in the body, so they can take a lot of force. But if we can lose weight to offload them a bit, where your body's not going to need to adapt and do lay down more bone and changes through there. Now, this happens anyways. The bone formation, bone turnover happens all the time, but we can kind of we can protect the joint by offloading it, and losing weight is a big thing, or increasing your muscle strength around. So if you have enough strength around the joint, you're able to protect the joint because you're able to dissipate those forces. So very commonly what we see is, especially in clinic, what I do is we tend to talk about any factors that we can change, and then start exercising. If we need to target certain joint muscles to get them stronger, we will. There's some programs that do that very well. There's the GLAD program that looks at individuals with osteoarthritis and gets them active and increases strength, and there's educational material in that as well. Other things like talking with your doctor is very important. Again, pain management, looking at any medications that they can use. That is all really important for you. Most likely will be your first contact is to go to your doctor. Other things, again, is just trying to stay active in the sense of finding activity that you enjoy. So individuals that I've worked with, they love kind of hydrotherapy. So going to a pool, getting the joints moving that way. Maybe switching your activity from, running to now you're going to do a little bit of cycling. You can get lubrication through the joint. But a lot of it is learning your own self-management strategies. What works well for you, what life adaptations you can do, working with your doctor, working with your healthcare professional, and then like your dietitian even as well. Maybe it's something in your diet that you can help as control your weight. But yeah, other things that you can protect the joints. Some doctors and healthcare professionals will say that wearing a knee offloader knee brace may be beneficial. And again, that can help for pain management, especially in the short term. Just kind of offload, let the knee calm down. And for example, I'm just giving the knee. It could be different joints. So it all depends on what kind of joint is present, where the osteoarthritis is, what kind of lifestyle factors and exercise you can do to target. So let's just recap. So osteoarthritis is a kind of after the age of 50 type of joint disease. Animal studies have shown that you potentially can reverse cartilage, but there is that point of no return. Lifestyle factors playing a big role. So inactivity or doing too much, loading a bit too much can increase the risk of osteoarthritis. Obesity is a big player in this, so managing our weight is really important in general. So yeah, that's kind of a basic overview of osteoarthritis. Again, if you have any questions, by all means, feel free to contact me. But otherwise, I hope everyone has a safe, active day, and hope to see everyone in our next video. Thanks.